There we go. So good afternoon, everybody. This is Rolando with Zyris. I'm here with Dr. Anna Vazquez, another one of our guests who's going to share insights, perspective, and also kind of all of the things that she's doing and how she's dealing with that with regard to everything that's going on. As this goes on, if you have any questions or if there are any, please feel free to send them through, put note there, and as we can, we will answer them going through this. So first of all, Dr. Anna Vazquez, it's a pleasure seeing you. It's always great to see you. And
hi, Ro. It's nice seeing you. I know we're both at home. We're definitely practicing staying home. At least you look very professional. I have a sweatshirt, so.
Well, I'll share with you what I'm wearing later on. But before we do that, so what's happening is it seems unprecedented right now. How many, just what's going on and how many things are happening in the world, and wanted to spend some time to get your perspective on that, and specifically as it relates to your practice, dentistry, and everything that you're doing. So could you just kind of give a general summary of what your practice is all about and how you're kind of navigating through that right now?
Absolutely. Well, absolutely. You know that we are going through a stage that the world has never seen. So this is completely new. There's absolutely no books that you can read. There's no protocol in any of our offices to say, hey, this is what you have to do. I have a philosophy in life that nothing happens to you. Things happen for you. So even though obviously all practitioners, we are extremely worried. I can only imagine new practitioners that are getting out of school with loans, with staff that they have never managed, and then everybody's looking at you like, okay, you're my leader. What are we gonna do? So it's hard. It's a lot of pressure on we as the owners. I know you know, but obviously people that are listening don't know. We have a pretty large office. It's one location, about 70 employees. So everybody looks at me like, okay, Dr. Anna, what are we going to do? What is this going to be about? What's going to happen next week? Well, if I knew all the answers, it would definitely, I would not be here talking to you. However, one thing that I can control as the leader of my practice is my attitude and how do I react to the news? Like I said, I think that things happen for you, not to you. Things happen for our nation. There's something behind all this that is going to get us more together. So in our practice, let me tell you one of the things that we have been doing since obviously we are closed. We are seeing though emergency patients because as a pediatric practice, we have about 26,000 active patients. So there's always emergencies that happen, and I don't want these patients to end up obviously in the emergency room. So we are treating those patients. But as an office, we have taken this moment to do other things that we usually don't have time to do. For instance, we are reviewing protocols. So that's something that as a new practitioner, you have not been able to establish protocols. What's going to happen with this? What are we doing this? This might be a good moment to do it. We're also reviewing for all our new employees. We like to do a training, and we like to have obviously everything ready for them. So that's something we're doing right now. So we are doing videos on everything that we do in our practice. Some of them are actually with our computer system software. So any new employee that comes to our practice can see them. And that's something that obviously we can have either one employee from home doing it, explaining it. I have a management team that have been actively working on it. So there's other things that we can do, but most important is our reaction. One thing that I told our staff when all this happened is like, at this moment, we have to work with the WIN rule. And I was mentioning it to you, WIN. What's important now? So what's important right now, obviously, is the health of our patients and our staff. So we're working on that.
I love the win concept because of the perspective is going forward as opposed to, oh no, we'll figure this out. When you look at how you're working with your staff right now. I mean, over 70 members of your team. Is your practice open? How are you managing that right now, and especially when you're treating some of these emergency procedures?
Yeah, actually, that's a very good question. Right now, with everything that's going on, obviously in our world, we are changing protocols. So nothing is going to be the same as it was 3 weeks ago. So changing protocols, like for instance today, that I was seeing patients this morning, because we are in a moment that we have to be extremely careful. So there were things that we would do. For instance, the patient stays in the car in the parking. They text us that they're there, and I have a member of the staff that goes escort the patient. We check their temperature, and then they go into a private room, and then that way we can definitely treat the emergency. Also, we check the temperature in every single one of our employees, to make sure that we're in compliance. We One of the good things about our profession is that we have been using PPE for 1,000 years. So this is not something new that now suddenly it's like, oh my gosh, we have to wear a mask, we have to wear glasses. We have been doing that for a while. So obviously we don't, 3 weeks ago, we were not taking temperature in our patients or our staff, which we're doing right now. But I think that from all the professions, dentistry is something that for us is not going to be a big change, because we have been doing it. We have been doing PPE. We have been cleaning our units. We have been. So it's just to make sure that the public knows that as a profession, all together, we do it. We have been doing it. I think that communication will be awesome. Social media, for some of the new dentists that are struggling, are thinking, oh my gosh, are my patients going to come back? What's going to happen? I think the public needs to know that we have been doing all this, that this is not now because of COVID-19. Suddenly we're going to start cleaning after each patient. It's something that we have been doing. How many utensils do we have in the office that are disposable? So it's something that obviously the patient never care about, but this is the moment to communicate with them.
That's so cool. That is so cool. So from a parent perspective, who's sitting here and happens to run into this, or what advice or what message are you giving out to the parents who are concerned about it? My child is in pain or whatever. What is it that you would tell them?
Well, first of all, dentists, we all should be available for emergencies. The majority of the emergencies, if we can treat obviously with antibiotics or pain control, but there's some emergencies that happen. Kids, now that they're at home, they are more active. They start getting into each other and siblings, and that happens. That's the beauty of kids. So we have seen trauma on trauma patients. There's some trauma that you can wait, but there's some trauma that they cannot wait. If it's something cosmetic, you can wait. But if it's a pulp exposure, you have to see these patients immediately. So obviously, as dentists, we are available. Every single one that I know, they are available for emergencies. And all we want to make sure is that our patients don't have to end up in an emergency room where those beds are needed for something else. So it's for, as a parent, first of all, I want to reassure you that there will be a dentist or pediatric dentist in a community that will be on call to be able to see your child. And I wish I could tell you that you can bubble wrap your child, but that's not allowed. So you just have to manage and let them be.
Thank you for that. It's reassuring, because there are people who are not quite sure how, and I love the message about you have been in dentistry, in the practices, you have been dealing with infection control, in cleaning, all that type of stuff. So I think that's awesome.
In all the years of practice we have gone through other moments that people were questioning, like, oh my gosh, are you protecting for this? We have been. In even at dental schools, obviously we're so particular about infection control and cross contamination. So for us as dentists, even more than in other medical professions, we are extremely worried about this, and it's something that we have been practicing. But once
That's
again, it's communication. Parents don't know that.
yeah, that's good. That's really good to know. Now, you have a massive practice and you've been around how many years?
I wish I could tell you that it was 10, but the truth is that it's been 25 years.
25 years. In looking at what you're doing, you're hunkering down with your team and you are working with them to figure out how to get through this. What advice would you give, especially someone who's just starting out or who doesn't have as large a base or is sitting there thinking to themselves, oh my goodness, I just started, I've got all this debt, and then now I'm being forced effectively to close for the next, who knows? There's a lot of uncertainty. What advice would you give people like that?
First of
Dentists.
all, breathe. Breathe. Take a moment. You're not here alone. We are all on this. It's not just that, oh my gosh, Dr. Such and Such has $500,000 in between student loans plus the practice. We're all on this together. Everything is going to work out. Absolutely everything. Do what's ethical and do what's the moral thing. Now, most of the dentists are going to be like, "Oh my gosh, what if I lose a patient?" Well, you know what? Just be who you are. Just do what's the right thing to do. The patients will follow us. The patients will come back. They're not gonna suddenly because we had to close for 4 weeks. They're gonna go to a practice down the street. And if the truth is, if they went down the street, then they were not your patients to start with. So it's easy for me to say because I have a very established practice. But I when I started practicing, I one lady that I was working with, she was my mentor. She said, "Anna, don't do anything for money. The money will come." And I know that we all have student loans. We then suddenly we have a mortgage, we have a payroll to cover. Do what's the moral thing to do. Do what's ethical. Do what you do well, and everything is going to work out. But breathe. Don't do it when you bring anxiety to the plate. It's just going to be. It's definitely going to be a disaster.
Thank you for that. How's that?
That's better. And another thing is like, and I'm talking about obviously a pediatric population, but we do not want to add to the anxiety of the parents, of the child, plus the dental procedure itself. So it's part of what we have to do, even as a general dentist. Your patients don't like you, let's be honest. They don't want to be there to have a crown done. They know they need it. So if you are anxious on top of all this, it's definitely going to be a worse experience for them. So as hard as it is, just this is the moment just to calm down.
Thank you. Thank you. So earlier on, you mentioned something about the emergency room. Now, I understand you also work in the emergency room at your local hospital. Is that correct?
That is correct. I do a big number of cases on the hospital. Right now, we are the only patients that I can bring to the hospital is true emergencies. Now, as a parent also, I understand if I come to you, Ro, and I say, hey, I can take your child for a case at this hospital, immediately you're going to be thinking, but aren't you seeing other patients that are COVID-19 positive? And that's true. So one of the things that, at least in my practice, we are doing some sedations in office to prevent and to allow the hospital to use those beds for what's really important at this moment. In the hospital, like I said, I saw close to 1,000 cases last year. And it's great for me. I mean, I think it's one of the most wonderful things that we can do in dentistry, especially in pediatric dentistry. But what's important now, that when rule, what's important now is that we don't allow this child to have a cellulitis. We don't allow this child to be in pain. So even though, yeah, it might not be the most wonderful idea to have to do an oral sedation at the office, that's the only thing that I have available at this moment.
So what is the definition of true emergency? If you were to define that, as a parent, what would that be?
Well, actually, the ADA did an awesome job last week on sending a review of what a true dental emergency is. And a true dental emergency will be cellulitis, when you have an abscess, when you have an infection, when you have a pulp exposure, when you have obviously some other fractures. So all of us that are members of the ADA, we receive specific guidelines that helped us whenever we get that call to differentiate, okay, is this a crown for an adult? Is this a crown that is out of occlusion, that it's something that we need to do because it can get worse? So the ADA did an awesome job just giving us that guideline. So obviously, as a pediatric dentist, I mean, a parent sometimes they call and say, well, there's a baby tooth that is still there and the permanent tooth is coming in behind. Well, that's not a true emergency. I have in my office, I am blessed that I have an awesome team that I have one lady right now on call, and she has been with me for years. So she understands, and she's my protocol lady. So she knows when it's a true dental emergency or not. And she can schedule. And obviously right now, since it's the uncertainty of being on the schedule, what we're doing is that she is definitely putting the patients at a certain time. So there's nobody waiting in the waiting room right now or in the reception area. There's 2 patients at a time. That's the maximum.
That is awesome. So, you've been a friend with Zyris for a very long time, and we so appreciate, the support that you've given us. We so appreciate the advice you've given. As far as your procedures right now, if I understand correctly, you use our system both in your office and in the emergency room. How is it effective? Is it something that other dentists should consider for the emergency procedures, or as it relates to that?
Absolutely. And you know my feeling about your product. I used the Isolite in the office. We have 19 rooms, and every single one is equipped with your unit. We use it as a pediatric dentist. I love the fact that in the office, even though I might have a child that is moving around, I know that I have airway protection, which for me is like the number one. I can have isolation on the area. I can work 2 quadrants at a time. High vacuum. Tell me a dentist that doesn't want that, to be able to work on at least a dry area. Now, obviously, you know that my passion is hospital dentistry, and I don't know if I'm supposed to say it, but I have been working with your company on an appliance that is it will be exactly the same as we're using in the office, the Isolite, but in the operating room is the best thing in the world. I use a throw pack when my patients are asleep, but being able to work on an area when the patient obviously is asleep. So we have a bi-block, so it's open. I have a constant suction. I would not work without that appliance, and I have been using it since, I think that pretty much since you started, and I have seen the changes in some materials. But I know not only I like it, I know that my staff adores working with it. My hygienist would not do a sealant if I cannot place the Isolite.
Do you see it as something, thank you for that. Do you see it as something that's also helpful for...
Oh, by the way, you're not paying me for that. I'm sorry.
No. So with regard to things like spatter or with aerosols, do you see it helping out in kind of helping minimize that?
Oh, absolutely. And obviously in the office, I cannot imagine a dentist that have not at least seen the product. It helps obviously because of the constant suction. On some of the other pediatric dentists that use it, sometimes we have these patients that get sick. And even as an adult, I mean, you have those patients, that suction comes in so handy, so handy. In the operating room for me is, and even though obviously I have a very important control in terms of the environment, being able to protect the airway and keep everything dry and not on my face, on my mask and my glasses when I'm in with the patient, it's priceless. And the fact that it's disposable. I know that we have talked about doing certain things that you can autoclave. I personally, I like the fact that it's a disposable product, that you don't have to worry about it. They comes in so many different sizes. As a pediatric dentist, I don't use the large, but I know you have one. It's for us has been a miracle, and you can talk to any of my staff members that we use a lot of expanded duties in the state of Indiana where I practice, and they would not touch a child if we don't have the IsoDrive.
Oh, thank you for that. Thank you.
You're welcome.
So your practice, is it open right now, or have you really pulled back? How much
No,
have you
we
pulled
we
back?
really pull back. We have been closed. This is our second week closed. Like I said, I mean, I see emergencies. We have other doctors in the practice, so we have been. My partner was on call this weekend. I was on call today, and I'm on call tomorrow. But we only for true emergencies, like just following the guidelines from the IDA.
And from a planning perspective, how are you attacking kind of now and then? How are you kind of setting yourself up for when we're through all of this?
And that's an awesome question. That's a very, very good question. And as all of us are on this uncertainty, what's going to happen? When are we going to be able to open? First thing is, once again, breathe and be positive. Obviously, we're going to go back to maybe a new norm, but we're going to go back. We're going to be seeing these patients. In my office, what I have decided is we're extending certain hours. If as a parent you probably know that, hey, I have my kids are not going to go back to school probably until next August, next September, so you have more flexibility in terms of the times that you have that you're offering. So we're going to be offering, we're going to start an hour earlier, we're working through lunch. And so it's just extending those times that might be available for parents to come and bring the child. And it's easier for some parents that have to take their kids to daycare. Well, then come a little bit earlier. And all of this is temporary. We're gonna go back. We're gonna go and we're gonna be able to do the same things that we were doing. It's just this time, and I think it's good to a point to understand. As as somebody that has a large practice, sometimes we get a little bit with that feeling of entitlement that I deserve this and I need this and I need that. Sometimes you have to pull back and say, you know what, first of all, thank you, God, because I love my profession. Number two, thank you, God, that I have people that are working with me that love what they do. And number three, thanks that we have a job. Thanks that that we get to go to some place and work. If you put things in perspective, I mean, these are first world problems to a point. We are not worried that a lot of other things could happen. We're safe. We have a roof. We have family that we love. So let's be thankful instead of just being on the negative part.
I love your message. I love how calm you are. I love the fact that, I mean, regardless of what's going on, you're always looking for a way to get through that. And I love the fact that your team. I've been in your practice, and I see how not only you work with, but how strongly your team is together. There's a note here, and I want to play it here. If you look, this is from Courtney. I'm honored and truly blessed to work alongside Dr. Anna. Such an amazing pediatric dentist, but more so, an incredible leader. Dang.
Well, and well, thank you, Courtney. The one of the things, if I know we talked before, if I had any message or any advice for new practitioners, one thing that I can tell you is that you need your team. You need a team that is united. You need a team that will work with you, and you need to expand. Don't think that I have to supervise everybody. I am blessed that I have a group of people that I could not work without. I know you have met all of them, Ro, and I know that you know that what I say is true. But
Yes.
for new dentists, I know it's hard. We work on a space that is this big, and then suddenly now we have so many things that we have to take care of. Find your people, find your tribe, and trust them, empower them, and train them. Education. We keep educating. Make sure that they keep educating, and they can be good at certain things that you might not be so good at. I love everything extremely organized, but and Ro, you know this is true. I I see a shiny light and I go for that shiny light. So all my team is like, Dr. Anna, come back to this, come back to this. So I have surrounded myself to people that are good at what I'm not good at.
Oh, that is awesome. That is awesome. Are you cooking much more lately?
But you know what? It's right now it's just Pearly, our therapy dog, and me. So I have not been cooking so much because I cook one day and then I'll take it for like 3 or 4 days.
How
I
much do
love
you
it.
cook?
Well, because we are supposed to be social distancing. Remember, I have to be home by myself. But whenever we can, I bring my staff, and this is the party place, by the way. This house usually is that where the party is.
Wait, is Pearly with you right there?
Pearly isn't here. You want to see her?
Yeah, let's see her.
Hold on.
Oh,
Hi, Pearl. Oh, she woke up. She knew. Here's Pearly. Here's Pearly. Oh, I know. I love you too.
so
Pearly is
Pearly is your
loving the
therapy.
fact. She's loving the fact that I'm home with her. So I'm pretty sure when we go back to the office and she has to go and see patients, she might not be so excited. Like right now, she in the morning she looks at me and said, "Hey, mom, we're staying home, aren't we?" So that's it's good for the two of us. We have definitely developed a tighter bond if that is possible.
Wow. First of all, what you say is inspiring, and the kind of your demeanor, the focus, and I have this. I've heard a definition of what leadership really means, and the definition that I live by is, someone who exhibits behaviors that you're willing to follow. Well, let me say, I would follow you anywhere.
Oh, well, thank you, Ralph. And if there's one thing that I can leave you with is remember that things happen for you, not to you. So use this moment. Use the things happen for your practice. So use it at this moment just to make sure that you're ready for the awesome things that are going to happen on every single one of our practices. So just embrace it and be positive and think, okay, what else can I do to serve my community, to serve my staff, to serve my patients? And there's going to be so many things. Just listen, just take a moment, just be quiet, listen to that whisper that it's going to come to you. It's going to come.
That is fantastic. I don't see any questions. If anybody has any questions here for another couple of minutes, be happy to answer them. But otherwise, Dr. Anna, you
And
make me
don't
smile.
forget to keep working on the OR appliance. I know Sean, I just saw him.
Ah,
And that is probably going to be one of the most wonderful products that you're going to have for people that do cases in the OR. I have been trying it and I think it's absolutely awesome.
that is well, Dr. Anna Vazquez, it's been an absolute pleasure. It's always great to see you. Your smile like lights up everything. Talk about making my day. I don't have that same smile, but I do have a bigger mouth.
Oh, I know because I have checked your mouth. That is so true.
That's right. That's right. Oh my goodness gracious.
And
Well,
I can't wait to go to Santa Barbara. That hopefully it's not going to be as gloomy as it is here in Indiana. But I love you guys' restaurants and places to go. So can't wait to visit you guys.
Well, thank you so much. Have a wonderful rest of your week, and please, please be safe. And if there's anything that we can do, I very much appreciate you spending the time and sharing your insights and inspiring us today.
Well, thank you. Stay healthy, and a cyber hug.
Oh yeah. All right. Take care.
So
Thank
take
you.
care.
All right.